Zoom number 13. My name is Dave Erickson and I'm the principal here at Hillcrest, and just on behalf of myself and my team, welcome. We're so glad that you could make it on this beautiful day. So we're trying something a little bit different today. It's a shorter version of the Hillcrest Zoom. And I'm not sure about you, but I've been finding an hour-long Zoom call to be pretty tiring. I actually was on one yesterday, and it was an explanation of the Pension Benefits Act of 1992 and the Pension Benefits Regulation of 1993. And it went over an hour, and I can tell you, I needed a nap, if not during, then certainly after that. But I can assure you that today's presentation is going to be way more interesting than that. So in light of that, I'm going to keep my introductory comments pretty short today. If you're here, it means that you've read the invitation and you're interested in the topic, and the speaker biography for Victoria Shaw was included in the invitation as well. So we're going to do our best to keep this to half an hour or even shorter. That'd be okay too. Just keep in mind, if you can be on mute, that would be great. And send your questions through to Jillian. She'll be moderating the session and keeping track of the questions for our speaker at the end. And also just a reminder that we are recording. And if you have to skip out or would like to invite somebody else to watch this webinar, you can certainly direct them to our website in the next day or two. So with that being said, I'm going to turn it over to Victoria and welcome her to share her screen and begin the presentation.
Thanks, Dave. I will just go ahead and get my screen shared here. So is that coming through okay? Perfect. So yeah, thanks again for having me today. So I'm going to be talking a bit about drug and extended health benefits and just the trends that we've been seeing from the COVID-19 pandemic. We know that it's impacted all aspects of our lives. So benefits is definitely no exception. So I'll kind of go through a bit of information and then I'll dive into some data as well. So as I mentioned, yeah, we'll talk about some trends kind of before the pandemic, what we're seeing, the trends kind of that we saw, the reasons behind them. And then I'll show some data to really kind of drive home what I'm going to be talking about. And because mental health is sort of a discussion in its own right, I just wanted to parse that out. So I will be speaking to trends in mental health separately. And then I'll finish off with just some future impacts, things to consider as we continue navigating the pandemic and eventually look at kind of time post-pandemic. So I'll start with trends and benefits. So as I mentioned, I wanted to just sort of set the stage with trends we were seeing before the pandemic came into our lives. And I'm focusing on drug and extended health today. So just starting with the drug line of benefit, we were seeing increasing costs year over year before the pandemic hit in 2020. And there's a few different drivers for that. We have, an aging population, an increase in chronic disease. Clinical practice guidelines have even changed so that we have more drug therapies available or even tighter management, earlier intervention. But I'd say the main driver in the last few years has been the increase in specialty drug utilization. So specialty drugs, I'm sure we're all familiar with, are high cost drugs, usually over $10,000 annually. And we just see more and more of those coming to market. So before they were kind of more unique, rare conditions, not used by most plan members. But we've seen a change where there's new drugs coming to market for more common conditions. So things like migraine and asthma, conditions that are much more common in plan members. So of course, when you have more using high cost drugs, it's definitely going to have an impact on spend. Then I'll move over to extended health. Also, we were seeing increasing costs year over year. And again, across lots of different aspects of extended health. But I'd say the largest growth that we were seeing even before the pandemic was in psychology. And we know that mental health is just such a common conversation now. We're wanting to help plan members, and plan members are willing to seek help. So that's definitely been a large growth over the years. But we were also seeing consistent growth in some of the paramedical, so massage, chiro, physiotherapy in their own right. But we do know that sometimes members utilize all of those therapies to treat just one ailment. So it could be that they have one injury, but they're seeing massage, chiro, and physio all to treat it. which is another reason why we're seeing increasing costs across all of those. So now I just wanted to kind of talk about the disruptions that COVID-19 pandemic caused across sort of all the stakeholders in benefits, so providers, members, and plan sponsors or insurers. I'm going to start with providers. So they really were impacted at the start of the pandemic. There was all of these restrictions and changes happening provincially that they had to adapt to. Many providers had to stop providing services altogether. So things like massage and physio back in the spring of 2020 completely closed down. Same with dentists as well. Or they had to reduce access. So they weren't seeing as many patients, patients weren't going out as much, or they were limiting in-person visits. So adapting to providing more virtual care offerings. And I'll speak a bit more on that on the next slide. And then they also were facing increasing costs. So either from having to adapt their service environment to account for physical distancing, barriers, things like that, but also having to invest in personal protective equipment as well. So masks, increased sanitation, all of those sort of components that we're all really familiar with now. So providers were really having to adapt to a lot of changing components over the past year. And so when providers are impacted, that's going to have an impact on members. So they're the ones accessing these services. So they themselves either had no access to some of their healthcare providers or reduced access. They weren't able to get in as easily, or they were delaying their visits, things like that. They also had limits on their prescription drug refills. So in Canada, there was concerns at the start of the pandemic, which again, I'm sure we're all familiar with, concerns with the drug supply in Canada, concerns with people stockpiling medications, and we just didn't want drug shortages to become a concern. So there was a recommendation back in March that across Canada that pharmacies limit refills to only a 30-day supply. So that was an impact on members. They had to go to the pharmacy more frequently. If they previously were filling 90 to 100 days, they were impacted. And then of course, just the mental and physical impacts on members from this pandemic. I'm sure we all personally are feeling the impacts as well. So mental health, as I have already mentioned, is a major contributor to what members are experiencing from the pandemic, but also physical as well. We're still, I think, learning kind of all the impacts that the pandemic has had on us. But I've seen reports on increased foot pain just from being at home, not wearing shoes as often, reduced physical activity, not being able to access fitness facilities, getting in your home workouts. So there's concerns with inactivity and obesity. And then the main concern being mental health, which I'll dive into a bit later. So all of these impacts on providers and members has had an impact on plan sponsors and insurers. So all of those closures, reduced access, we're seeing irregular or reduced claiming patterns in our benefits, which again, I'll show some data to support that. And then also having to adjust some of the management strategies we employ. So on the drug side, it's pretty common that plans have either maintenance medication programs where they encourage members to fill a 90-day supply whenever possible. So the 30-day maximum had an impact on that management strategy. And also with members not being able to see their doctor as frequently, maybe get all the lab work they normally get, most of insurers had extended special authorizations. So where you normally need to submit updated information to kind of renew your special authorization, we're kind of extending that out. So lots of different impacts across, all parts of benefits, and they all definitely kind of interplay into each other. So going into virtual care a bit more, virtual care isn't new. It was around before the pandemic, but the pandemic has really accelerated the growth of virtual care offerings. So just to kind of illustrate this a bit better, I've put some statistics on the slide for you. So you can see on the first one that almost half of Canadians have access to a doctor using virtual methods, and they were satisfied with the results. So they're starting to see that these offerings work, and they're getting benefit from it. Here in Alberta, Alberta Health Services mentioned that Oh, sorry, I'm just getting a bit of feedback there. I don't know if anyone else is hearing that. I think we're okay now. Here in Alberta, Alberta Health Services said at the peak of the pandemic, about 90% of their clinic visits were virtual. So we were really utilizing this care offering. Moving over to the next one, psychologists. So when we think of psychology, it does tend to lend itself well to moving to a virtual option, sitting down and speaking with your healthcare provider. So that can be done virtually. But usually people do still prefer to see their psychologist in person. But just a statistic from the Canadian Psychological Association said that they found that 71% of Canadians were willing or somewhat willing to see a psychologist virtually. So there's more exception by members on utilizing these services. Then the last statistic I wanted to put on the slide, just because it's not one that we normally think about easily converting to virtual, is physiotherapy. And it definitely has its limits in this form of health. But what they found is that physiotherapists will do sort of utilize multiple modalities. So they will see some in-person visits, but they might be able to do some follow-up assessments, maybe virtually. And back in June of 2020, 62% of physiotherapists had said that they were providing care virtually in some capacity. Again, it's not usually only done virtually, but they can integrate it into their practice. So bringing this back to insurance is we've had to adapt to make sure that we're accepting claims that are provided virtually as well. So diving into the data, and I really like these slides because I think it helps to drive home all those trends that I've spent all this time talking about. So on this slide here, I'm just using our Alberta Blue Cross book of business data to kind of illustrate some trends for you. And the top line in the dark blue is the drug line of benefit. So as you can see, if we look at the 3 years kind of pre-pandemic, 2017, 2018, 2019, we're seeing kind of pretty consistent growth year over year. And then when we get to 2020, it wasn't overly impacted. It's sort of continuing on that trend line. There was definitely some impacts, mostly from the 30-day prescription maximum that we saw, but pharmacies were open throughout the pandemic. Generally, people need to continue taking their medications, so we're not seeing as much of an impact in that area. If I move down to the extended health in the lighter blue, I talked about how there was increasing growth year over year before the pandemic. So you can really see that illustrated here from 2017 to 2019. And then 2020, there was that reduction. And it's not maybe as much of a reduction as we would anticipate, because we know that massage, chiro, physio all closed for a period of time in 2020. But other services like psychology increased in that year. So it kind of balanced it out. Still an overall reduction, but not every component within extended health reduced. And again, I'll speak to the psychology services in the mental health section. So wanted to show those irregular or changing claiming patterns that I spoke to on an earlier slide. So starting with our drug claims. So this is showing the number of claims on a month-to-month basis. And I just have on the screen here for you 2018 and 2019, just to kind of give that current state before the pandemic. And you can see that there's slight fluctuations from month to month with claiming patterns, but overall fairly consistent. And 2018 compared to 2019 is also pretty matched, a little bit higher in 2019 as we increase utilization, but overall the same. So I bring on 2020, and you can see in the green that it's much different from the previous years. So we're seeing these sort of spikes in claiming patterns. So the first spike in March, I'd say that's probably due to that worry of stockpiling. People were stockpiling things more than just drugs. Toilet paper is always the main one that comes to mind, but people were worried. They didn't know what to expect. They wanted to make sure they had everything they needed. Then that 30-day maximum came into play across Canada. And so we see it kind of fall there. That was lifted in June, which is our next big spike. So people could go back to the pharmacy, start to refill again for their larger day supply. So I'd say the main spikes here are definitely due to that 30-day maximum and some of those restrictions at play. And then you can see it sort of leveled off later on in 2020, a little bit more back to normal patterns. So then we'll move to the extended health side. And I just focused in on the paramedical claims. So I'm showing here massage, physio, and chiro. And again, I'm just starting with 2018, 2019 to kind of give that baseline of what things were looking like before the pandemic. And again, as you can see, some fluctuations from month to month, some increased growth from 2018 to 2019, but overall fairly consistent. When I bring on 2020, again, huge difference from the previous years, but opposite of drug, where we were seeing spikes higher, paramedicals, we saw this huge spike reduction. And again, those closures of these services was definitely the biggest driver for these claiming the trends we're seeing in 2020. And then we did see, April really plummeted down as things started to open up. It was sort of a phased opening. So things like physio and chiro opened and became available before massage, which sort of lends to why there's a gradual increase kind of from April kind of up to June. It didn't kind of jump right back up right away. So this doesn't illustrate irregular claiming patterns. I don't know what will, but really interesting to see kind of how this changed. But again, similar to drug, leveled out kind of near the end of 2020 back to more regular patterns. Okay, so I'm going to leave the trends behind. We're going to focus in on mental health as promised. So before we get into the numbers and the trends, again, just wanting to set the stage a little bit, kind of pre versus during pandemic. So mental health in Canada has been a conversation for a few years now. More awareness is going towards it. People are understanding that it's an issue. And this was all before the pandemic was at play. So on the left side of the screen, if you look at a statistic sort of pre-pandemic, we knew that 1 in 5 of Canadians were diagnosed with anxiety or depression. So I think we can all either know that we're impacted ourselves or we know someone who's impacted. And that was just with the day-to-day stressors that we all experienced. The pandemic was not even a factor at that time. Moving into the pandemic, as we all know, it has caused increased mental health concerns across Canada. So a few statistics on the slide, 84% of Canadians reported worsening mental health. So I find this one is important because, in the previous statistic, we say 1 in 5 is diagnosed, but many of those people may have had their mental health under control. They were treating it, they were feeling okay. So even though they have depression, they were able to manage it. But if those people, kind of moving into the pandemic, we might find that their symptoms are increasing. They're not managing it as well. So it's not just new diagnosis. It's also people who were already struggling, having the impacts from the pandemic, maybe disrupting the control they had over their condition previously. And anxiety is another huge one. So the next statistic there is reports of high levels of anxiety have quadrupled. So again, maybe I was a bit anxious before, but it's moved up in the pandemic for sure. I'm getting those high levels of anxiety. And I think it's important to note too that these statistics, while it is broadly across Canada, there are surveys and things that show that the working population is similarly experiencing these. They are also having worsening mental health, anxiety, things like that. So now that I've sort of set the stage, I'm going to pop into the trends and some data again. So what I'm doing here is I'm looking at mental health drugs only. So not drugs overall, but I'm just looking at the ones that are used to treat mental health conditions. And that's in the darker blue bar, kind of year over year. And then the lighter blue, I'm looking at just the psychology services on the extended health line of benefit, so that we can kind of hone in on mental health. So if we start with the darker blue, year over year, not as much change. It's interesting to see kind of from 2017 to 2020, it's increased a bit, but nowhere near the rate of increase that we were seeing in psychology. So where there was previously a large discrepancy between spend on drugs versus psychology, psychology is sort of bridging the gap. And year over year, it's getting closer. And in 2020, you can see it's the closest it's come to kind of getting up to the spend we see on drugs. And not only that, you can see that it's double-digit increases year over year, even before the pandemic. And that's really continued on, which means people were continuing to utilize their psychology services, whether it be in person or virtually during the pandemic. So on the next slide, there's a lot of numbers and things going on. So I'll explain kind of how to read this slide in a minute. But what I wanted to focus in on is clinical practice guidelines for treating mental health generally isn't, drug only or psychology only. It's usually a combination of the two. And more commonly than not, we recommend to start with just cognitive behavioral therapy or psychology services. That's usually your go-to start. But in severe cases, you might want to start with both drug and psychology, but it's not usually, a drug-only treatment method in the guidelines. Now, what we see in practice is not quite the same. And I think there's a few different reasons for that. We all know it's easier to kind of take a pill once a day than to dedicate the time and energy into going to a psychologist, going to a session to talk to them, going through cognitive behavioral therapy modules. It's a lot more of a commitment. So we do find, and even from my time working in community pharmacy, it was really common to see people come in with prescriptions for an antidepressant. And when asked, are you also doing cognitive behavioral therapy or seeing a psychologist, they often said, no, I don't have time, or maybe their coverage wasn't as good. So we see that reflected in the data. So what I'm showing on the slide here is that dark blue would be a claimant who is claiming a drug benefit only. There's no claims for psychology services on there in the last year. The blue would be a claimant who has claimed psychology services only. There was no claim for a drug, mental health drug in the past year. And then the green, which is the smallest one, would be claimants who had a claim for psychology services and a mental health drug in the past year. So we can extrapolate that to assume they're utilizing both treatment methods. So good news on this slide is if we go kind of from top to bottom from 2018 to 2020, the number of drug only is reducing, which is a good thing. That's kind of getting more towards what we recommend of more psychology or combination therapy. And then that green on the far right is increasing year over year. So we're seeing more people accessing both benefit options in treating their mental health conditions. So this is a more of a good news slide, but I think we really want to see that continuing to grow year over year. We want to see more access of either multiple methods of drug and psychology, or maybe trying psychology first before going to a drug. So I'm going to finish off here with just some future thoughts, future impacts, things to consider as we continue navigating the pandemic or look to a post-pandemic time. So some of the considerations I have here are, there's some pent-up demand from the reduced access to care, or maybe even delayed diagnosis happening. So a common one that I've seen statistics for is cancer diagnosis. And even here in Alberta, Alberta Health Services did note that their cancer diagnosis was down 30%. So they are anticipating with people not going to the doctors regularly, there could be some misdiagnosis happening. So we're not sure, how that's going to play out in benefits. If we're going to see some spikes from more diagnosis, it'll be something to watch for sure. And I also think of other illnesses like blood pressure or cholesterol, where, you don't feel if you have high blood pressure usually or high cholesterol. So if you're not going to the doctor regularly and getting your screening, that could go undiagnosed as well. So just some things, to look out for as we move ahead. Another big question is, we know that we've had an impact on mental health. We know that we're struggling, but how long will these impacts last? And, how will that impact our utilization of the benefits? And I came across a really interesting statistic from Ontario Medical Association was looking at, mental health in terms of the pandemic. And one of the references they used, we don't have a lot of pandemics to draw from, but they looked back at the 1918 flu pandemic, which of course cannot be paralleled to the COVID-19 pandemic. But from that pandemic way back in 1918, they saw mental health diagnosis specifically related to that pandemic up to 6 years after the pandemic had ended. So I found that really interesting. Again, of course, it's not an exact correlation to COVID-19 pandemic, but just gives an interesting look at what we've seen historically. So my guess is that we're going to be seeing mental health, an issue even once we're vaccinated, maybe things go back to normal. I think mental health concerns are going to persist, and how long I think that's the question. It's hard to say how long that might be going on. And then lastly, virtual care, we know has been accelerated by the pandemic and more people are utilizing these options. And I don't think that that's going to go away. I think it might reduce a bit when people are able to access in person, but that's going to continue. People are going to want to have alternate options of seeing their healthcare providers, not only because of social distancing, but maybe it's harder for them to get to the doctor, live in a more rural community. These types of offerings are really helpful for a lot of different reasons. So I definitely think we're going to see those persist moving forward. So that is all I had for you today. It's a lot of information in a short period of time, and we do have a bit of time here for some questions. So happy to answer any questions you guys might have.
So please feel free to send questions through the chat function, and I'll kind of field them through to Victoria. But I have one to start, just maybe while we're waiting for some to come in, which is on the psychology, the increase in claims surrounding psychology. Do you think that these are mostly COVID related, or do you think there's other factors at play that are causing this increase that we're seeing?
Yeah, and that's a really good question. I think we know that we're seeing mental health becoming more prevalent. We're seeing, more people suffering from it. But I don't think that increase, especially because we saw it was increasing before the pandemic, is just related to, more people are suffering from mental health. It's sort of a multi-layered reason for it. So it could be that, we know there's reduced stigma to mental health. So while people were probably suffering before, maybe they weren't as likely to seek help, go to a psychologist. But we're seeing it being more accepted, more the norm. So people are more willing to access treatment. And then we've also seen employers, plan sponsors recognizing how important mental health is for their members and looking at their psychology benefit and maybe enhancing it. So it's not often that we are enhancing benefits, we're always trying to cut costs, but psychology is one where we do see plan sponsors wanting to increase the benefits that they're offering to make sure that they're supporting their employees. So that could be another reason, of course, when you offer more benefits, you're going to see higher costs associated.
Absolutely. When you mentioned the psychology drugs or mental health drugs are stepping up, but maybe at a slower pace than the psychology paramedical claims. What percentage of total drug spends would be made up by mental health drugs?
Yeah, I think that is variable from plan to plan. On our book of business, it's usually around 8% of total drug spend. So still a significant portion of drug spend. And it's usually, if you're going to look at your health conditions by spend, like diabetes, mental health, cardiovascular, it's definitely up there with those top conditions for sure.
And maybe just one last question before we wrap up is more broadly, when we look at the healthcare, the impact to healthcare of the pandemic, can you speak a little bit about whether you're seeing a lot of COVID specific claims having an impact, or is it more just the broader kind of impact of the lockdowns and the change to everybody's life that is causing the increased claims?
Also a really good question and great timing, because we recently looked into that ourselves. And what we found was, COVID related treatments is kind of like a drop in the puddle. We're seeing some movement, but it's nowhere near enough to drive any major trends. So I would say, no, it's not. Usually the treatments for COVID-19 as well are low cost traditional therapies. So if you see a bit of a spike in them, it's not usually enough to cause, like, oh, we saw this massive spike in our drug spend. I'd say there's definitely other factors leading to it. Mental health being the biggest one, and then those changing restrictions, as you mentioned, causing irregular claiming. I'd say that's more so what we're seeing causing these trends.
Thank you very much.
All right, well, I see it is 10:29, so we're right on time. Thank you so much, Victoria, for that great presentation. For those of you who are numbers people or statistics people like I am, and my team I know is, you'll find that very informative. Or if you're just in charge of the benefits spend and at your organization, that's really informative as well. So thank you, Victoria, for taking the time to prepare and present that for us today. And thank you to everybody for attending today's session. Please do let us know if you enjoyed the shorter format. Just send us a quick email. And we'd be great to hear just if you like that format, and also any ideas that you have for upcoming sessions. And thank you again, and enjoy the rest of your day. We'll let you get back to it.
Thanks, everyone.
Thank you.